Hi, my name is Rick Hoff and I'm with MFTCseminars, and I wanted to take just a few minutes of your time to talk to you about scar release. Throughout the different seminars that we've been doing over the last year, a number of you have asked about scar releases, and sometimes we've had time in a seminar to demonstrate and other times we have not. So what I wanted to do for the next few minutes is just give you a presentation about a scar release and to review the aspects of that scar release with you. One of the things that you need to understand is that fascial tissue component has a tendency to tighten down into scars after we have had a surgery or a trauma of some sort. Certainly your umbilicus or your belly button is your very first scar, and you can use these principles to release the umbilicus just as easily as you can releasing a regular scar. Understand that another name for scar tissue, if you will, is of course fascia. Fascia is a component of connective tissue, which is a component of what we refer to as scar tissue. Now, the example that we're going to use today in this scar release is an individual who had an appendectomy, and you can see very clearly when we get to the scar release portion of the video how that scar is literally being pulled down into the tissue. It's very tight, and so we want to literally release that entire scar, but we need to work from the superior angle to the inferior angle in a clockwise position, and I'll talk about that with you as we go through the release aspects of the scar. So why don't we move from my office into my treatment room, and we will there get started on that scar release, and I'll show you just exactly what I'm talking about and what I need you to do in that scar release. Okay, as we talk about a scar release, we're looking at starting up at the top of the scar so that the scar is basically the top of a clock. So we're looking at 12 o'clock down to 6 o'clock at the base of the scar. So in between, of course, we have 1, 2, 3, 4, 5, 6, and of course the other numbers of the clock coming back up to the other side. What we're going to do is start up at 12, and we're just going to work into the top of the scar just to feel for any areas of point tenderness, nodules, or tightness. As we do that, then just keep working around the area of the clock and making sure that you talk to your patient about what they're feeling in regard to the scar and if there's any areas of point tenderness. This scar has been around for a while, so there isn't really a lot of point tenderness, but it's still being pulled down into the body with some significance. So as we look at those different areas, and you find an area where you feel point tenderness, we're going to come back to that. So actually work the entire area, just checking and palpating through, looking for areas of point tenderness, and just work the faces of the clock. Once you've done that, then come back and find an area, and we're going to use we'll use 9 o'clock as an example. I want you to just drop in with a couple of fingers, and as you feel the tightness in there, then just start to work in and start to release that tissue. Sink in using a fascial timeline, minimum 90 to 120 seconds, and then as it releases, allow your fingers to start to work further into that scar, into the tissue. And then as it releases, your fingers are maybe moving apart. You can also mobilize into some of that tissue to create some additional space. What you'll do is work through that entire area, through the entire scar, until you've released all of the areas of point tenderness and released the fascial structure that's pulling into the scar. Remembering that tissue memory plays into this, and knowing that you're going to have to come back and work that scar again a number of times in order to break down the adhesion and to create space. Once you've accomplished that, then periodically, look back to the scar. Some of these scars do have emotional attachments as far as tissue memory is concerned, and you need to make sure that you are dealing with that aspect of it as well, and that your client, your patient, is always comfortable, and that you're communicating with them what they're feeling and checking certainly for their toleration of the work that you're doing and making sure that you're not putting them through hurdles of pain. This should be one of those aspects where it hurts good, the no pain, no gain philosophy. does not apply here at all, and if they're going through hurdles of pain, then you need to look at other options of releasing the tissue so that it's not painful, but you don't want to tighten everything up that you've been doing. But work through that specific area and then work the entire scar, and then come back and visit with them again at about 2 to 3 more visits afterwards, and then see how much adhesion you've broken down in the scar. As you can see, as you look at the scar and as you work through that tissue and work around that tissue, make sure that you're doing appropriate transverse cross fiber, but also sinking down into that fascial component, giving yourself plenty of time to release the tissue. Not only is mobilization important, but also doing a cross-hand release over the scar. Also doing micro releases, using your fingers and doing small releases, sinking down into that tissue. But most importantly is remembering the fascial timeline, minimum 90 to 120 seconds. You've heard me say that in seminars, and you will always hear me talk about the importance of spending time. In our industry, we seem to be so caught up in making sure that we cover the whole body that we don't look at spending appropriate time in specific areas. Make sure that you are using that fascial timeline. Make sure that you are sinking down into that fascial tissue. Make sure that you are giving it appropriate time to release. As you go through the process of a release and you give it appropriate time, the results that will come back to you will be 100-fold. And that's what I want you to understand. Myofascial release is a technique that can change lives. It is a technique that can bring somebody in who is in dysfunction, chronic dysfunction, and bring them into function. But you have to spend the time in the system to get it to release. So many times I've had people that have come up to me in seminars and have said, wow, I really got this down now. I can get a release in 30 seconds. And I look at them and say, no, you haven't heard a thing that I've said. You're only getting the surface of that release. You're just getting the tip of the iceberg. You've got to remember that's what is underneath the surface is so much larger. You've got to give yourself time to sink into that tissue and get it to release. 90 to 120 seconds minimum. Could be taking you 5 minutes to get one release that gets the action down into the structure. You're peeling away an onion, multiple layers of tissue. You've got to give it time. It's the same thing with a scar release. You've got to give it time and you've got to work it. You're not going to create an effective release in a scar in just one session, especially with the scar that we used as an example. It's a big, deep scar. You've got to work it. You've got to treat it appropriately. But in time, yes, that scar will start to open up, and it will start to become looser, and the adhesion that is holding and binding that scar down will certainly become considerably less. I hope you've enjoyed this, and we look forward to sending you other videos in the future. And have a great and wonderful day, and yeah, we'll see you on the road at our next seminar. Thanks.